Hello, and welcome to Occupational Therapy and Physical Therapy Descriptive Writing Training. The purpose of this video is to provide a descriptive writing training to educate new and existing therapists on how to fill out documentation. It is vital to the success of your patient, as well as the facility providing therapy services, that you fill out this documentation accurately, effectively, and providing enough detail to receive Medicare reimbursement. We will begin today with a free write exercise. Your prompt is to describe your favorite place using every sense with the exception of sight. Take 3 minutes to complete this exercise. Now that we've got you thinking creatively, we will move on to a tutorial on how to successfully write concise yet informative descriptions of rehabilitation services. Following the writing lesson, you will watch a rehabilitation scenario and fill out sample documentation as if you were the therapist providing the treatment. At the end of this training, you will turn in your descriptions to be approved by the facilitator. The first method for writing medical documentation is SOAP notes. We will now break down each level of this acronym. Subjective. This includes any significant complaint made by the patient or information the primary caregiver provides about the patient's progress. Take the complaints of your patient and organize them into a condensed statement. Observation. This component includes documenting any vital signs, measurements, or findings from physical examinations. This can include noting normal or abnormal findings regarding the client's conditions. Be sure to note nonverbal signs as well. Assessment. The assessment portion is essentially your professional opinion about the meaning of what you have observed in the therapy session. Provide analysis of medical diagnosis, progress, or evidence of problems. Plan. This final step indicates the therapist's plan for continued treatment of the problem. This section should include barriers of progress and why the client should or should not continue to receive therapy. Now that you know how to write SOAP notes, use this tool as a framework to write narrative notes. Narrative notes are sentences pieced together to be informative of what was done with the patient. This type of note-taking will be used throughout this training. The second technique for filling out medical documentation is setting SMART goals. We will now break down each level of the acronym, providing you a better understanding of how this tool will help you set sound goals for your patient. Specific. This aspect of the tool is to ensure that your goals are clear, concise, focused, and well-defined. Specific goals are more likely to be achieved than general goals. Measurable. This aspect of the tool establishes a measurement for your patient's success. Set a deadline or percentage of improvement. The ability to measure his or her progress will help keep your patient on track to reach the desired results. Attainable. When setting goals for a patient, you should make sure he or she is physically capable of safely accomplishing them. If not, consider aiming for a smaller goal. Realistic. Goals should measure outcomes, not activities. A realistic goal includes manageable steps that can actually be reached by the patient. Timely. The final aspect of this tool is to set a realistic time frame for the patient to accomplish the goal, including a starting and ending date. You should already be familiar with outpatient documentation, but for this training we want to highlight certain sections where you can apply the descriptive writing models you have just learned. The first document is the initial evaluation form. For this form, we will focus on the following sections: prior level of function, past medical history, reason for referral, and medical necessity. To fill out these 4 short answer sections, utilize narrative notes. We will also focus on the functional goals and outcome goals sections of this document. Be sure that the goals you set follow the SMART goals model. For prior level of function, shown here, you are explaining what level of functionality the patient was at when they first began treatment. For past medical history, you are writing down any surgeries, treatments, medications, or anything else related to their treatment. For reason for referral, you are explaining to Medicare or Medicaid why the patient needs to continue therapy. This is crucial because if this part is not descriptive enough, Medicare or Medicaid could reject it. For medical necessity, you are explaining why it is necessary to continue treatment. This section justifies the need for intervention and identifies what skills will be employed and the risk without immediate intervention. For functional goals, you will be explaining the short-term goals that you have in mind for the patient. Notice that this section says patient will meet functional goals in blank weeks. Be sure to set a realistic time for meeting these goals. Finally, for outcome, you will be explaining the long-term goals that you have set for the patient. For functional goals and outcome, keep your SMART goals in mind. All of these sections need to be as descriptive as possible as you are using these to convince Medicare or Medicaid of why it is important to continue seeing your patient. If they are not descriptive enough, they will be rejected, which is a problem for both you and the patient. The second document is the Daily Record of Treatment form. This is used to record daily notes of services or evaluations of the patient's progress. For this form, we will be focusing on the weekly progress section, which includes short-term goals and long-term goals, as well as previous week and current week summaries. We will also look at the supervisory notes section. The short-term goal and long-term goal section of the document should record all goals for the patient's progress as they continue therapy treatment. The previous and current week portion of the document should include a detailed record of the patient's progress throughout the week. You should refer to the daily notes to properly fill out this section. The supervisory notes section of the document should include evidence of progress, potential barriers to progress, and a summary of why the patient should continue or discontinue treatment. The third and final document is the Rehabilitation Discharge Summary. The two main components to focus on are the summary of functional progress towards long-term goals and the summary of patient/caregiver training. These sections should document functional limitations using discipline-specific terminology. The summary of functional progress requires an overall summary of the services the patient received, how the patient progressed through their treatment, and why they are eligible for rehabilitation discharge. The summary of patient or caregiver training should provide clear instructions for the patient or person taking care of the patient after they are discharged from the rehabilitation center. This includes observing for warning signs that the patient may need further medical attention or ensuring the patient is taking all prescribed medications. Now we will begin the scenario activity of your training. Please turn to page 2 of your handout. Take a few minutes to read the boxes titled Prior Level of Function, Past Medical History, Reason for Referral, and Medical Necessity for your hypothetical patient. Now please view this clip of a patient receiving an initial evaluation.
Casey, I'd like you to come sit over here in the chair, please, okay? And then go back over there to the bed. All right. Is that hard to do?
Yeah, a little bit.
A little bit? I'd like to see you stand up, please.
Okay.
Just stand there for a moment. You straighten up there. And let go of the walker. Why don't you walk forward for me? And stop. Can you pick your right leg up? Okay, and walk backwards. And sit down, please. Was that hard to do?
Yeah, it was pretty difficult.